Hi, good night. We have the workshop. So let's wait to my classmates, yeah, my students. In that way, I'll be back as soon as the first one gets into. See you in some minutes.
Hi, Miss. Good night.
Hi, Diana. Give me a minute, please.
Okay.
Okay, I think I found a solution there. I'm with my baby now. She's a little upset. And I'm gonna ask someone to come to pick her up.
I can wait like for the other group so you can have time with your baby. It's fine.
Okay, I'm back. Thank you for your patience. Okay, Diana, can you watch my screen?
Yes, it's okay now. Well, I was telling you that you can be with your baby and I will wait for the other group, but it's fine for me. I don't have a problem.
No worry, we can stay. My
Okay.
husband is here, so I came with the baby. I was thinking that my baby was hungry, but no.
Okay.
She wants to be with her daddy.
Oh, this
Well,
is she. Oh, that's cute.
yeah, that's a nice baby. She's 3 months at this point. So
Oh
small.
my gosh, she's so sweet. She's so little.
Yeah. Okay, let's check this.
Yes.
On exam. Temperature, BP, pulse, okay. Respiratory rate, free air, perfect. That's correct. About the abdomen, a little pain while palpation in hypogastrium, okay, could be. Right below ureteral point, superior and middle, little painful, okay. Right lumbar percussion positive, could be. Genitourinary system, rectal exam, big mass in the middle of the prostate, okay. I was showing more details about the prostate during the information I sent. Do you
Yes,
remember
but
that?
yes.
The sharp, well, the big mass, the size
Mm-hmm.
was big, I think. Let me open the file for not making a mistake in that way. Oops, where is the file? So, yes, it's opening now. No, it's not. When we evaluate prostate, we got lots of details to take in count, right? And one of its details is the shape.
Okay.
Okay, yes, it's here. Yeah. Okay. Let me stop sharing and I'm gonna share again, showing you all screens, okay? Okay, can you watch it now? This is a similar information I sent. Avoid this part. This part is not important at this point.
Okay.
Well, there's a dialogue. Okay. Vital signs. Okay, perfect. Abdomen prominent. Well, when we say prominent, is because the patient is obese, right?
Mm-hmm.
Thing that we should add because it's so fat. This patient is elderly.
Okay.
Little pain of the patient, the hypogastrium could be no palpable mass. Okay, right. Okay, as I was showing you in the example, when we get information like this, right or left, we should make the abbreviations with a capital letter, right?
Oh, it's right. Yeah.
That kind of abbreviations. Pielorenoreteral points. Well, that's the whole term developed and well, everything written. But in Spanish, we have an abbreviation. Do you remember that?
Oh, no.
Puntos pielorenoreterales PPRU, right? Or not
Oh,
writing F. That's in Spanish. In English, you can say pielo, P, reno, R, ureteral, U, PRU, again,
PRU. Okay.
PRUP. When you get
PRUP.
superior, you don't write down superior, you only write down sup.
Sup.
Okay?
Okay.
The same, when you say middle, you don't write middle, you just add mid.
Mid.
And that's
Okay.
with and we have a symbol that could show what it's meaning, what the meaning is on this. Do you remember that?
No. No, I don't.
It's in your keyboard, might be number 6. It's like an 8 with 2 tails. Yeah.
Oh, yeah. Yeah, I know why. I know what is it.
Right. That's the abbreviation we can use instead of writing down and. That
Okay.
symbol. Well, a little painful could be again. Right, again with capital letters, just lumbar percussion, painful, one cross. Okay, perfect, could be in that way. That, as you can see, there are details for change.
I need to make abbreviations.
Yes, use abbreviations. Why I'm asking for this exercise? Because if you have the chance to read medical record in English, you are going to find abbreviations. And you have to take in account the similar ones, the common ones, to read this information properly.
Okay.
Okay.
Yes.
Rest of the exam and AD could be, there's no trouble. Digital exam says, well, I didn't set NAD, I changed it. It says bigger than also, okay, I written that in the example.
Yeah, you did you put like digital rectal exam, big size, rigid, sharp contour, just a big mass in the middle of the prostate. No pain during the evaluation.
Yes, I changed it because with an ID, nah, but big size, okay? Could be size, big. That characteristics, the bigger size, rigid, the sharp contour, and the mass, of course, are parameters we must evaluate. And that's why they should be into the description, okay?
Okay.
We say no pain during the evaluation at this point. We support that we evaluated pain too. That's why we should add this detail, no pain and no blood. Okay?
That's relevant. Okay.
Yes, that's important at this point. Rest of the exam and AD, that's correct. So correct this as soon as possible. If it's better if it's tonight for catching these details and not mixing ideas. And that's all. This first exercise. Okay?
Yes.
Perfect. Correct this. And at the end of the workshop, as always, around midnight, I'm gonna send the homework file and the written exercise. This for a score, okay?
Yes.
Great. Any question, maybe, Diana?
No, right now.
Okay, great. Good night, Pablo. Diana, this poll is for you. Oh, hi. This poll is for you, Diana. Okay.
Okay.
So, keep a second. Fill this, and Pablo, please don't fill the pool yet because we are going to work together. Okay.
Okay.
Okay, Pablo, did you write down your exercise?
Yeah, I did.
Done it. Good night. Thank you.
Good night, Diana. Thank you so much. Thanks for your patience.
Bye.
Bye-bye. See you Monday. Okay, Pablo. Let me see. I'm gonna let you to share a screen, okay? Is that possible for you to do that?
Yeah, I got red.
Okay, great. It's done. You can share a screen now.
Okay, thanks. Share. Just wait a second. Hold on. Share. here. Can you see it?
Aquí estoy trabajando. Okay, great.
The case report and the physical exam, right?
Okay, just physical exam at this point.
Okay.
Okay, great. But you were checking Diana's job when you get into, right?
Yeah, I was kind of picking.
Yeah, don't worry. It's so brief. As you can see, it's very easy to make it. It's a very brief exercise.
Yeah.
Okay, physical exam. On exam, temperature, great. Well, when we evaluate some structures, like in this case, prostate, we have a protocol to follow.
Okay.
According to that protocol, we know which structures we must evaluate according to the diagnosis we are looking for, or maybe the complaints that the patient is talking about, right?
Yes.
In that order, if following the first steps in the physical exam, we get some extra findings that are not expected, then we can look for some more structures.
Okay.
Right? That's why in this case, it's not a part of the protocol to evaluate oropharynx.
Okay.
Okay, well, you're writing down, okay, that's great. Cardiovascular, perfect, pulse, regular, okay, BP, rest, you can say rest, NAD, or rest of the exam, NAD, okay?
Okay.
Because if you just send me NAD, it's
Okay.
making a contrasting information. I mean, you tell me nothing to add, but you're giving me values that are important. 105, in this case, is tachycardia because of the value, but we have to consider more situations according to that, okay? Regular, okay. Respiratory, beats per minute, stat, NAD. Same, rest of the exam, NAD, okay?
Okay.
Just for adding this detail is gonna be a better way to show that you properly evaluated all the systems, okay?
Okay.
Abdomen, ABD, perfect, prominent, little pain or palpation in hypogastrium, okay, superior and middle right PPRU, point to little painful, right lumbar percussion, plus, okay. Digital rectal exam, big mass in the middle of the prostate, painless and bloodless, perfect. That's a good point. You added this detail that is usually forgotten.
Yeah, I thought it is negative, but I think it is important about talking about
Yes, that's
the medical
correct.
exam.
It is important. We have to support that there is no pain, that there is no blood, because if we find these details, well, we can change diagnosis, right?
Yes.
But let's check small details here. Little pain, little pain, okay. When we set superior and middle, we got abbreviations on this. For
Okay.
example, with superior, just SUP, SUP, okay? With middle, MAD, mid. While reading, following the context, I catch that sub and mid are superior and middle, okay?
Okay.
For and, for this word, this connector, you can write down the full word, the full term, that's correct, but you got a symbol to make something like an abbreviation, and it's universal for many situations. In your keyboard in number 6, we got a symbol like that is similar to a number 8 with 2 tails.
Yeah, mine is in 7.
Okay, yours is 7,
Yes.
perfect. Well, this symbol can be placed instead of and.
Okay.
It's universal. In many situations, we got the chance to exchange this symbol, okay?
Okay.
And following the example I sent, we got right and left. Do you remember that?
I think yes.
Yes, when we said right, we only use the capital letter R. Do you remember that?
Okay. Okay.
We're showing me the side we are talking about. Right and left, well, with right in this case, let's change it. And while talking about pielorretouretral points, in Spanish, we got an abbreviation of this.
I don't remember.
Do you remember? No, don't remember that abbreviation? Well, in Spanish, when we said puntos pielorranureterales, we could say, we can write down PPRU, right?
Okay.
It's an example for that. In English, you can say PRUP, pielorranureteral points, PRU. Okay, little painful, again, right with abbreviation, great. Digital rectal exam, perfect, big mass in the middle, again, mid, just of the prostate, painless and bloodless, perfect. Just details to correct, because I can imagine that that's the first time you are writing down a physical exam in English, right?
Yes.
So don't worry about it. That's the best way to start, because you are catching how to write it down with all the elements it certainly needs. Just the detail about abbreviations. Don't worry, you're doing a good job. Okay. Okay, so can you close the screen, please?
Okay.
Thank you. Let me share some details. It's Yana's. Yeah, that's okay. For example, here here you get same detail as Diana. You're not talking about size, about rigid, about the sharp contour. These characteristics, these details that I'm sending are important elements to describe into prostate evaluation, okay?
Okay.
You can say digital rectal exam, 2 dots, then prostate, 2 dots, big size, rigid, sharp contour, or big mass in the middle of the prostate, or big mass in the middle level of the prostate, painless and bloodless, as you said. Enough. That could be a way to do that. There are many ways according to your own experience. Same as in Spanish, okay? We can receive guidelines, but the way we decide to write down is personal, right? Is the way we are used to do this, okay? Any question until this point, maybe?
No, doctor.
No details to take in count. Perfect. Let me see. Well, let me send you the pool instead of forgetting this. So check the information, correct the details I'm showing you, and send me your file, this first one and the correction, to my WhatsApp now. And well, that's all for tonight. Okay?
Okay, done the pool, doctor. Thank you.
Thank you so much. Tonight I'm gonna send the homework file to the WhatsApp group again. And the second written exercise, I mean, when I'm gonna send you a new dialogue with new details for writing down everything, okay? I mean, case report and physical exam.
Doctor.
And well, let me, and then I'm gonna send a message to her because we were out of time. But when we report lab tests, imaging tests, we only focus in positive information. I mean, if you have a normal white blood count cells, WBC, you only say unremarkable, as I was showing you in the presentation. It's not necessarily to give me values, just conclusions, okay?
Okay.
When we talk about ultrasonogram, I think it is, for example, let me see if it's a file. Yes, great. If I show you this ultrasound, what would you see here? Right, and this report. Following this report, you should give me your conclusion into the clinical history, right?
It should.
When you get the chance to receive a report like this or pictures like the sonogram, You don't have to write down details that are in the description. You only go to the conclusions.
Okay.
According to the conclusions, we can consider that we are working faster. Maybe you should add a specific detail because if it's so important at the moment, but if it's not, don't worry. It's not necessary to use that. Okay?
All right.
In the report, well, I'm gonna send it and explain to the group details that I'm telling you now. But following this information, you find abbreviations like this. Do you remember I was talking about it?
Yeah. See.
This is WIT.
Okay.
I mean, grade 3 enlargement of prostate, WIT, rigid renal, right renal cyst.
Okay, it's like a C.
Yes, actually, it's a C with a hat with a triangle in the top.
Yes.
It's very common in medical English to find it in written reports, in the medical history, in conclusions, on indications. Very common to find it.
Okay.
It's faster to write down 4 letters, just one, right? It's easy. That's why we can count that.
Okay.
So if you have the chance to use this, use this. I'm taking into account who's writing down with abbreviations and who's not.
Okay, doctor.
Okay. Well, there are examples about lab tests, lots of lab tests in this patient. And as I was telling you, you only give me conclusions. For example, here you got extremely high PCA, for example.
Yeah.
You got some details to take account from this. I'm going to send this exercise to the group of practicing. And next workshop, we are going to work on this.
Okay.
So correct until the physical exam. And following the information you're going to receive, it's easy, very easy to make the report about labs and imaging tests.
Okay. Got it.
Okay. Any question until this point?
I don't think so, doctor. Thanks.
Okay, Pablo. So don't worry and please send me now the 2 files, the first one you were sharing and the corrections, okay?
Okay, good. Got it. Thanks, doctor.
Okay, bye. See you Monday.
See you
Have a great
Monday. Bye-bye.
weekend.
You too. Bye-bye.
Thank you. Bye-bye. Good night, Jimena. How are you? How was your day?
Hi, Dr. Iris.
Everything okay, Jimena?
Yeah, I'm okay.
Okay, Jimena, let me see. Previous workshop, you didn't come. You didn't get into the Zoom call.
Yeah, I prepare for my souls. I prepare snacks for All Saints.
Okay, well,
For
in the previous workshop, I was talking to Jacqueline because she's a professor like you. And well, she was hearing the explanation to the doctors about the physical exam that they are practicing how to write down, but it's just a medical purpose. In your case, in order you are not going to be a doctor, and you don't certainly need to know how to do it, how to write down this kind of information. You should prepare an explanation about the diagnosis that the patient is receiving. I mean, we should try to find a way to explain properly a patient all the information that the doctor is giving in order to practice, okay, how to give information. It's the best way to work with you at this moment, okay?
okay, okay,
We're
Doctor.
not missing these activities. So let me share a screen and I'm going to show you the situation, and you're going to receive your homework file tonight.
Our homework about the practice, the following guidelines. Yeah, that one I have.
Yes, this is the file I sent to the group for practicing about the Joseph Jones. Do you remember that man who's having trouble while going to pee? And well, in previous workshop, I talked to your classmates that there are the findings, the physical exam they should write down with all of this information that I'm sending in order to practice. All of this information, well, you got some details that can be important. For example, the temperature, what's this meaning, or blood pressure is normal, pulse is a little bit high, respiratory rate is normal, and oxygen saturation is normal at this point. So vital signs, we can say they are almost in the correct value. So there are not a huge trouble at this point. Following this information, patient is suffering a urinary tract infection, benign prostate hyperplasia benign hyper. I got confused. Let me organize my idea.
Okay.
Benign prostatic hyperplasia. Yes, that's good. That's the way. I mixed the idea.
Okay, doctor.
So, with the information that I'm gonna send tonight, you have to prepare a small paragraph explaining the situation to this patient, okay? I'm gonna send more details to the group, and you have the weekend for write down this part of the exercise.
Okay.
Okay, in your case, we are going to work in that way. In your case, for Jacqueline and you, because it's out of your objective to write down as a doctor, you don't certainly need that detail, right?
Okay. Yeah, it's a little bit hard or too hard for me, especially, to give diagnosis or analyze these points.
No. The only information I'm gonna send you to your personal WhatsApp and Jacqueline is having all the details. Only check the information and explain me as if I were the patient. What is the meaning of that terms? Because all of these terms we are checking from module 1.
Okay.
Just give an explanation. Don't make an analysis. Don't look for if there's under normal parameters. That is not important for you. It's out of objective. but it's important, I think, to give the proper information with proper terms, right?
Right.
That's the way we are going to work with you and the way that I'm going to evaluate you in order to improve the speech maybe while giving information. It's different for doctors' objective. They have to know how to write down in medicine. But you're not a doctor, you don't need the details.
Okay.
Okay, is there a question about this detail I'm showing you?
No, I don't have questions, doctor.
Okay, great. Did you have enough chance to check the slides I sent you?
Yeah, that's great. That's great.
Okay, great. Is there any question about them?
No, I don't have any questions, doctor.
Okay, great. So tonight while finishing the workshop, I'm gonna send the homework file as always with all of its details. And tomorrow I think I can send you the exercise with for giving me the explanation, okay?
Okay. Okay, doctor. Okay. Thank you.
Oh.
Thank you very much.
Okay, perfect. Let me send you the pool to take attendance and don't miss in this, okay?
Okay, doctor.
Okay, can you watch the pool?
Yeah. I think
Okay, perfect.
I can watch that. Simply,
Okay, thank you. Okay, thank you so much. Well, I think we got everything, okay?
Okay, doctor. Have a nice
Oh,
night. Bye-bye,
thank you so
doctor.
much. Bye. See you Monday. Have a great weekend.
Thank you very much. Same as you.
Good night, Dorian. How are you? How was your day?
Yeah, good night. Good night.
Everything fine?
Yeah, so far.
Okay, great. Let me see. Did you have enough time to write down your physical exam?
Yeah, I did it. I don't know if it is right. Just was a little confused about how to describe the atomic observations and that. So
Okay, no worry. Let's check this.
Mhm.
Okay, yes. Can you share your screen now? I got it. The Zoom is letting you to share a screen. Is that possible for you to do that, or do you prefer to send me your file?
I can share you my screen. I don't know if you're looking.
Okay, great. I got it.
Yeah. I
Thank
was
you.
trying to compare this to the past workshop we had and just make a little bit of that. Use as much abbreviations as possible, but I don't
Yes.
know if it's okay. I mean, as far as I know, it's understandable. I don't know.
Okay, well, let's check. Well, when you got values like this, you don't explain if it's normal or not. So take it away, okay? It's normal,
Oh
it's
yeah,
not necessarily.
yeah, yes. I forgot about this. I just
No,
okay.
no worry about it. Okay, on exam, temperature, pulse, BP, okay. You decide to add the vital signs in the first line next to the temperature, right?
Yeah.
Okay, they should go next, not like a list.
Oh, okay. Follow by.
Yes, that's an important detail. It looks non-remarkable at this point, but actually it's important in the way they're writing down because of lawyer purposes.
Okay. Like
Which lawyer ones? Certainly, I don't know, but that's the explanation they gave us in the med school when we were learning how to do this. Okay?
it should go like this, right?
Yes. Yes.
Okay.
Pulse should go next to the temperature. Everything in the first line.
Oh, okay, okay.
Okay, great. That's the way.
Okay, okay.
CSV and respiratory. Okay.
No.
Okay, that's a detail we have to consider. Well, it's very common to check this information. When you evaluate a patient, you are going to learn it when you get into that part in med school. You
Okay.
got protocols to evaluate following the diagnosis you are thinking on, right? Following that protocol, you know which anatomical structures you start evaluating and which information you have to look for. And if during this process you find something that is unexpected, then you can add some systems.
Oh,
In this
okay.
case, with this patient, we don't have to talk as a fact about the cardiovascular and respiratory system because I'm not, or at the first time, I'm not sending information like that, systems specifically, just vital signs.
Okay.
And they are not a part of the diagnosis at this moment. So if you decide to send me it in that way, for example, respiratory systems and vital signs, perfect. That's correct.
So,
But the cardiovascular system, well, it's not important. At least you add the vital signs here, previous to NAD. Okay, that's a detail. If you send me like respiratory system, vital signs, then you give me a comma, and then you said rest of the exam, NAD. It means that you made the auscultation, percussion, palpation of the thorax,
oh,
and there is nothing to show.
oh, okay. Cause I was thinking about that cause there was nothing really interesting or something like that. Just was nothing out of the ordinary. Really, just
Yes,
we
yes,
was kind of confused about what to add. Like if we find like um particular mass or irregular thing, but then we add, but it's normal. So what should I do? I just was thinking about that.
Okay, great. No, it's normal. For example, NAD, because all the exam is negative, as I was telling you in previous workshop, right?
Okay.
But if you prefer to give me vital signs in the system they belong, comma, and then rest of the exam, NAD, just for supporting you made your job and evaluate all the structures, okay? That's for lawyer purposes because you don't have to avoid information.
Okay.
Okay, in this case, going to the abdomen, hypogastrum, pain, okay, could be palpable mass. Okay, where is the palpable mass? NF?
Not just resume, not found. That's
Could be not found, but if there is not found, it's not important to add that information.
um,
Yes,
so
just avoid it.
hypogastrium pain must be most
Yes,
relevant.
hypogastrium with little pain, you can say, or with pain just. Okay, that's a detail.
Okay.
Let me see.
But
For example, when you say with, we got a symbol for exchanging that word into an abbreviation. Do you remember that? I was showing you that in the previous workshop and in the Monday class, I think.
I was looking at those abbreviations, but I forgot. I was just checking on that.
Don't worry about it. That's with is the C with a triangle on the top, or maybe a line, or maybe something, a hat or something like that. That detail is the abbreviation about with. You can say hypogastrium, that's C with the triangle, with pain, enough.
Oh.
The palpable mass and F, well, avoid this. It's not necessarily, okay?
Okay. Oh.
Ureteral, upper and midpoints, perfect. Pain, right lumbar, pain. Yep. Okay. When you say ureteral points, right?
Yeah.
When you evaluate that structure, you consider pieloreno-ureteral points. That's the big number, the big name, I mean, because you have an order to evaluate 3 points in the abdomen. We should look for 2 because 2 of them are possible to palpate in the abdomen. The third one is by the rectal exam or maybe the vaginal exam. In this case, well, pieloreno-ureteral points could be upper or sub, and midpoints perfect, positive or pain, or with pain or in pain could be.
Oh, okay.
They were right, so you have to add which size, left or right. Okay.
Oh, I forgot. And then right.
Yes,
Okay.
yes.
Right.
Okay.
Right.
Perfect. The right lumbar what? Right lumbar percussion in this case, because we have to show which maneuver we developed in this case. Right lumbar percussion, pain. Okay.
Okay,
Yes,
percussion.
in this case, yes, you have to give me in this case the maneuver because that's the one that is working on. Okay.
Oh, in this case, this is relevant.
Yes, in this case, yes, because we made that maneuver and just that maneuver is in pain. Rest of the maneuvers not. OE positive.
But
This,
no, just was describing the maneuver, just to
okay.
maybe keep it
Yeah,
organized or something.
yes, take out the OE and stay with the 1+. Okay.
Okay.
Digital rectal exam, great. The only one who made this kind of abbreviations. Thank you. Sharp control, rigid, big size mass. Okay. Red mice, big misses on prostate. You don't need the OE again.
Yeah, just was
big
was
mass in
adding.
prostate. Okay, lack of pain, no blood or bloodless. Okay, the NF is not necessary.
Was abbreviated.
They're not found. It's not for medical English.
No
not
blood.
in that way. Yes, lack of pain, no blood. Enough.
Okay.
The OE, when we take big size mass in prostate, enough. The OE is not necessary.
Oh, yes.
Okay. Okay. Now it's better. There are small details to keep on correcting. Don't worry about it. But you can notice a difference like this, right?
Yeah.
Okay, that's the way we have to work on. That's the way we are practicing how to write down the physical exam. And as you can see, it's easy to make. It's not as hard as it looks, but certainly needs a medical basis. That's why it could be a little harder for you, but it's possible to do it. It's possible to make, okay?
Yeah, I just Yeah.
And until this point, you are the only one who sent me abbreviations about site. For example, the R, the DRR. Well, details that your colleagues are not sending me. Yeah, it happens. Yeah. Thank you so much. I
No.
take it in count. Certainly, I
Okay.
consider this information.
Okay. I just was thinking about that. Just a little, I got a little problems with like the procedures, like maybe difference between percussions or palpation. Like, but I didn't know how to make a proper uh, abbreviation for that terms, but it turned out interesting. This example.
Great. Now you're catching this. This is a very easy case, a very
Yeah.
easy clinical situation. Tonight I'm gonna send the homework file, and I'm gonna send the writing exercise with a different case. So keep on practicing. So don't worry about it. You're doing a good job, Dorian. Don't worry about it. Okay, that's important to recognize you're making a great effort because, well, you certainly need more basis, but you are making a great effort in this. Thank you so much.
Yes.
That's
just the second exercise right? Yeah. Then we got to do the second exercise, not the first one, like case report, or also we got to do the case report from the past homework.
Yes, with this new writing exercise, you have to give me case report, physical exam, and the readings about labs and imaging tests. Why? Because it's so easy. In the when I send you this exercise, I'm gonna give you an explanation how to do it, and you're going to catch that it's very, very easy to make.
Okay.
Okay, perfect. Okay, can you stop your screen, please?
Yep.
Okay, perfect. Please, I need you to send me the paragraph you made now with the corrections we are doing together, okay? For having the support to send me homework file.
Okay.
Okay, Dorian, let me send you the pool for you just. Okay, Laura, good night.
Hi, teacher.
Hi. Well, did you check in the WhatsApp group the objective of tonight to work on the physical exam about an example I sent?
Yes, I'm not sure if mine is okay. But I was listening to everything you told to my classmate, and I was taking all the notes. I couldn't enter. Sorry, that's my dog. I couldn't enter to Tuesday practice because I was at work, and I didn't know if I had like the right to do this exact homework because I missed the practice.
No,
Okay.
don't worry. So, good night, Laura. Laura y Awita, yeah. Both Lauras are together. Okay, let's do
Good
it.
night, teacher.
Good night. Okay, Dorian. So with you, we got everything done. So let's meet on Monday, okay?
Did you send did I send the attendance? I don't know. I don't remember.
You didn't feel that?
I
got
think
an answer. You feel the pool, right?
no, I think I didn't.
Oh, oops, I received one pool and I thought it was yours. Okay, Dorian, only you could feel this pool. Laura, yeah, please wait a little bit, okay?
Yeah, thank you so much. Sorry about that.
Oh, no, don't worry, that's great. So see you Monday, Dorian,
Okay.
and keep on reading. Any question about it, please let me know by a message. You need a basis for doing this, but it's not possible to work on that way. Let's try to make the best effort, okay?
Okay, I'll let you know.
Okay. Have a great weekend, Dorian. Bye-bye.
You too. Bye-bye.
Bye-bye. Okay. Laura Yowita, hi. Let me know, did you have enough time to write down the exercise I sent to the group?
Yes, teacher, I sent you.
Okay, let me check. Laura Peredo, send me to my WhatsApp your homework, a picture or a screenshot, something with your job, okay?
Okay,
Yes.
I'll do it right now. I'll send it to you.
Okay, thank you.
Okay. Thank you. Can I leave the call or?
No, continue. Stay, please.
Oh, okay.
Yes, because we have to work with your job too. And it's important to check your answer. Okay, let's start with Laura Yowita, yeah, because I opened her file at the beginning, yes. And I'm gonna expect your file, okay, Laura Peredo. I'm sorry for talking in that way, but with two Lauras is not so easy.
It's
Okay, can you watch my screen?
Yes, teacher.
Okay, great. Let's go with you, Laura Yowita.
Okay.
On exam, you decide to send me the vital signs on the top. Thank you. Abbreviations are correct. Thank you. Abdomen level pain while palpation in the hypogastrium. R, piloretroentral point superior and middle, little painful. Okay, could be. Right, perfect. Lumbar percussion, one cross. Okay. Digital rectal exam. Okay, big size, rigid sharp contour. Just a big mass in the middle of prostate. Rest of exam and ED. Okay, perfect. Let's check just a small details. Laura, you got a good job. It's a good paragraph. But let's check some abbreviations to consider at this point that they couldn't look so, not too important, but they are so common in English. For example, when you tell me superior and middle, you got abbreviations that are even coming in social English. I mean, when you say superior, you can send me SUP, SUP.
Okay.
When you said middle, just send me mid, MID, and that's enough. For example,
teacher.
there are two ways to do it, okay?
Mm-hmm.
When you tell me end, you get the chance to use a symbol. In our keyboard, in number 6, maybe 7, we got that number 8 with 2 tails, right?
Yes.
That symbol is very common in medical English, even in social English. So if you have the chance to use that, use it. Sup and middle, little painful could be right lumbar percussion. That's great. Only you and one colleague more get the R as an abbreviation. Digital rectal exam. That's correct if you develop all the term like this, but could be another way to tell me that. DRE, just the capital letter, okay? The first one. Digital rectal exam, DRE, okay?
Okay.
Big size, rigid sharp contour. Okay, that's correct. Just a big mass in the middle of the prostate. This just it's not necessarily only a palpable mass in the mid of prostate. Enough. Okay.
Okay, teacher.
Hello. Okay.
Okay, teacher.
In the file you got no pain and no blood. The two parameters are important because we are supporting our findings, and when we talk about prostate situations, we have to describe the details because they are into the protocol of this kind of evaluation, right? You can say no blood, no pain, bloodless, painless, something like that. That is showing me that you are focused on the structures we are evaluating, right? Just add the detail. These magical words, rest of the exam, NAD, is correct, is well done. It's a good way to show that you are focused on the complete physical exam, okay?
Okay, teacher. Teacher, I have a question.
Yes, let me know.
In the part of pielorenoreteral points, superior and middle, also we can
abbreviate pieloreno-ureteral like PRU?
Yes, PRUP. Perfect. That's the way you can do it.
Okay.
I was
Okay,
forgetting that detail.
Okay.
Yes, because it's a universal abbreviation. That kind of details are all over the world being shown, so it's possible to make it. So don't worry about it. That's correct. Okay.
Okay, teacher.
Until this point, is any other question maybe?
No, teacher.
Okay, great. In that way, prepare your corrections, please, and send me that picture, okay, for checking all the details again and practicing more, okay?
Okay, teacher.
Okay, let's check yours, Laura Peredo. Let's make the exchange, yeah. Again.
Okay,
Okay.
give me a
It's
minute
Dorian.
to. Can I like send it to your WhatsApp even if it's just like the text, because it's not on like on the file itself.
You are typing.
It's typed.
Yeah, send it to
yes.
me. Okay.
Okay.
Just send it to me and I'm gonna paste it into a file. Don't worry about it. Let's check your job, and that's all. It's a very good way to practice in this way because, well, we have the chance to improve our writing skills. Let me open a file. Well, tonight while finishing, well, around midnight, I think I'm gonna send a homework file again. And this homework file is about the presentations of this week and writing exercise. When I'm gonna send a new medical case, you have to write down the case report, then the physical exam, and give me the readings about lab tests and imaging tests. It's so easy, a very easy way to do that, because you only give me conclusions. Don't support all the values. It's not important to give me normal values when we talk about lab tests, only the positive facts. And in talking about imaging tests, only the conclusion that is in the report, or maybe your own conclusion if you consider it's a good way to support that studies. It's according to your own experience how to do it. But the topic ideas on this kind of information is so clear. It's easy, very easy to make. So don't worry about it. Okay, I got your answer. Thank you, Laura. Wait, what is this? Okay, can you watch my screen?
Yes, I can.
Okay. Mr. Jones, well, it's not necessarily temperature, 37, BP. Okay, let's start with this. You need the abbreviation here. Do you remember
we can
which
do
one
like
was
BPM. I was not sure about that. Look.
Yes, BPM.
Okay.
That's the abbreviation.
Because
okay, BPM,
I was a
respiratory
little
rate.
confused about the pulse and the respiratory rate, because they would be like the same abbreviation, like BPM.
Yes, both of them get the same. The difference is the context and the value. It's not possible to get in pulse 19 beats per minute, right? So don't worry. According to the context, we catch the meaning about the abbreviation, BPM.
Okay, I was not sure about that.
Okay. No, don't worry about it. It's for practicing this exercise, but in the correction, we realize the changes, okay? Again, respiratory rate, double R just.
And teacher, I have a question about the oxygen saturation.
Yeah.
When the patient is like getting oxygen, we have to put like I don't know, 60% free air and 85% with oxygen intake support. How can we say that?
No. Wait, well, this weight with the hat, with the line on the top, I don't get it in my keyboard, but wait. For example, following your idea, okay? 60 is a value for thinking on mechanical ventilation, so let's go with 78. 78 free air, comma, with oxygen supplement. I'm sorry, my typing is off. With oxygen supplement, 98%. You can say by mask, for example. By mask.
Okay.
That could be an example how it changes. And oxygen, no. You can say OSAT, O2 SAT. I'm sorry. My typing is awful. I don't know what's going on with this.
Because
O2
I had a patient today, and he was from Canada, and he had pulmonary edema. So we had to explain that how his oxygen was working to his they were not his family, they were just like some friends he met through the internet, and he was staying here with them, and we had to explain that, and I was not very sure how to explain how the saturation was getting better, like the difference. I was not really sure about explaining it.
Okay, so imagine I'm your patient. Explain me how the oxygen works. I'm scared, I cannot breathe, and I'm far away from home. How you could tell me, how you would give me this information?
I would I would tell him that right now,
no, tell me. I'm your patient. Talk to me as if I were the patient. It's better.
Your lungs are filled with liquid right now. That's why you can't breathe. The main treatment for this right now at the moment is to give you supplementary oxygen, and we're going to do it to get your oxygen saturation better, for you to feel your breathing much better. And this is going to increase this, and we're going to give you this oxygen by mask.
Okay, perfect. But what about the liquids? How they get into my lungs?
What happens here is that when he arrived from you arrived from a place that was on sea level or highness, their sea level was normal. Here in La Paz, we have a really high sea level, so we have different breathing pressure. So when this pressure starts going up, fluid is going to penetrate your lungs through the capillaries, and that's why it's filled with liquid right now.
Oh, that's why they are going into my lungs, because they need more space.
No, they don't need space. The pressure has gone up. Their air pressures that our body manages normally, yours is up because your body's not used to this higher pressure on the air. So that's what happened.
Okay, so I only need the oxygen just. Okay.
You're going to need much more than oxygen, but right now that oxygen is what is going to help you breathe and to feel better. You're going to need some medicine that's going to help that liquid to be I don't know how to say it, to help to that liquid to be out of your lungs. That liquid is going to be drained thanks to some meds we're going to put you on, and that's going to be the final treatment with the oxygen, and you have to be relax, and you have to be ¿cómo se dice internado? You'll have to be checked here in the hospital for a few days.
You have to get admitted.
Admitted into the hospital for a few days. Yes.
Okay, great. That's a good way. Well, of course, the patient is scared, but that's a good way to let him know that he must stay. You must get admitted into the hospital for treatment. No more questions. Yeah. Okay. Yeah, but that's the way. You're doing a good job. You made a good explanation about this situation. That's the thing. But going back to the answer, yeah. Abdomen, hypogastric pain, right? PPR supplement with you. I can exchange it in my keyboard with yours. Painful.
Okay.
Yeah, big mass. You just hear mid and hear not, yeah, of the prostate. And there are more details that you certainly need to describe, right? Don't worry. Let me see. It's possible to watch. It's possible to watch. Okay, there are some details I'm showing. Big size, rigid, sharp contour, and no pain and no bleeding, okay? No bleeding.
Is it necessary to mention that? Because
yes,
those are not positive points on the physical examination. So I was having a little doubt because we don't.
Okay, it's not necessarily because it's a part of the protocol of evaluation of prostate. That's why you have to support that you took into account the details that are a basis of diagnosis, and well, you need to add this small detail at this point.
Okay.
Just a detail, but that detail is supporting that you are clear on the protocol and you can work on. It's the same with your patient with high attitude syndrome. You have a protocol to evaluate him, right? You have to evaluate instructors. I mean, looking for edema, looking for signs of cardiac arrest or failure or something like that, right?
Yes.
You have to look for signs of major decrease in oxygen. I mean, cyanosis, peripheral and central cyanosis. I mean, we made lots of lab tests looking for complications that at this point could not be noticed because the patient is still standing the attitude. Following that protocols, same situation in this case. That's why we need more details following the first example. As we were checking with Laura's, following your example, Laura, thanks for being my example. You got more information to add to your physical exam, okay?
Okay.
So consider these details, correct it, and send me by a message.
Okay. I will.
Okay, so that's a good way. And don't worry, this part of the exercise tonight is for practicing just, not for a score. But the next one is going to be for a score. In this way, you can make me questions about it because I realize that that's the first time that we as a group is the first time we are writing down a physical exam in English, right? It's different, of course, in Spanish. We have different ways to give this kind of expressions. But that's the way, just writing down, we can focus and realize what kind of abbreviations we certainly need. If there's a question with the homework file, but specific questions, for example, how is that possible to make this abbreviation? And you show me the abbreviation, I will tell you if it's yes or no. That's the way it works, okay?
Thank you. I'll correct it and send it to you.
Yes, thank you. Add more information. Let's work on this. And well, there is the pool for you both to fill your attendance. Thanks for your patience. Thanks for being here.
Okay.
And any detail, we can talk via message during the weekend. There is no trouble on this, okay?
Okay. Thank you, teacher.
And as I was telling you while we were sharing the screens, we got the chance to make the report about lab tests and imaging tests because we only talk about conclusions, about positive information. We don't have to describe, we have to describe normal values. Maybe, for example, if hemoglobin is normal, we can say, if hemoglobin is so important for the diagnosis, we can say hemoglobin unremarkable enough. I don't need the value in the description, okay? Don't need to check numbers, just conclusions.
Okay.
Okay, so it's going to be easy to make. You're going to notice this. Okay?
Okay, teacher. Thank you.
Okay, Laura Yawita, is there any questions, something to talk about maybe?
No, teacher, it's all clear. Thank you.
Everything clear, easy to make, right? Just keep on practicing, don't worry about it. The next exercise, the writing exercise, is for a score, of course, and you have to send me case report, physical exam, and lab tests. All the information I'm going to send to you, okay?
Okay, teacher.
Okay, so please be patient. Around midnight, I'm going to send everything. In that way, I think that's all. Hey, we got this workshop done.
Thank you.
Okay, teacher. Thank you very much. Good night.
Bye.
You're welcome. Thank you for being on time. Thank you for your attendance. See you Monday. Have a great weekend.
Thank you, teacher. You too.
Thank you. Bye-bye. Okay, that's all. I got everything done. And well, an extra explanation with one of my students that I was not expecting, but that's correct. That's okay. So that's done. Everything, everybody, well, not everybody came, but I had a chance to work with the most important ones that are interested on this class. So see you. Bye-bye.